Thank you very much for joining us again at this particular time. Now, today we want to look at trauma care, and also treating accident victims. Now, trauma is a major public health challenge worldwide, and according to some statistics, it accounts for more than 16,000 deaths per day and also causes more than 312 million patients yearly to seek medical attention. Now, it is the commonest cause of death among people under the age of 40 who constitute the economically viable population, which is a significant loss economically for the family, the society, and the nation as a whole. Now, in addition to this, several thousands more with non-fatal injuries end up with disabilities. Now, in Nigeria, accidents, of course, happen various ways. We have road accidents, building collapse, criminal attacks, and the list goes on. And the incidence of fatal road traffic accidents, for instance, appears to be the highest in developing countries, especially in sub-Saharan Africa. In Nigeria, for instance, with a population of over 140 million people, the annual incidence of trauma deaths has been put at 1,320 per 1,000 people. Now, we're looking at this, and we're looking at how we can improve Nigeria's trauma care system and create more awareness on this. Now, to help me do that, I am joined today by Dr. Amaka Adekoya. She is the Program Manager, Trauma Care International Foundation. It's a pleasure to have you on the program today.
Good morning, Zoe.
Thank you very much. Okay, and also, by the way, you have an opportunity at some point to call in and ask questions if you do have any as regards our topic. We're looking at treating accident victims and trauma care. You are free to do that. Okay, we're talking about trauma. First of all, to be really certain as to what we are talking about and not to assume anything when we say trauma to the body, physical trauma, what exactly are we talking about? What are we referring to in this instance? Let's begin there.
Okay, I think we can just use a simple definition that when you talk about trauma, you're talking about injury to any part of the body that could either result in death or disability. There are different grades of trauma, and Trauma Care International Foundation is actually an NGO. What we do is we want to improve the way people respond to physical trauma and their attitude towards emergency response through health education, community-based programs, and a lot of advocacy. So we are focused on physical injury, physical trauma, and those areas in particular.
Okay, so essentially it's harm to the body in a physical way. Yeah. Okay, so I'm talking about that. How would you rate being in that organization, being in that NGO? How would you rate or assess the response to trauma care, or maybe accident victims, you know, in the past, from what you have been able to observe personally?
In our environment, I've always said that our people we have a very good mindset. We have this good Samaritan mindset. So when there's an accident, when something happens, you see people rush in to help. But I feel that there are better ways to improve to emergencies, because respond to emergencies, and they would benefit from training. You find someone that somebody just had an accident, and you see someone just stop his car and rush into the road and is pulling the victim, and is not thinking, what kind of injury has this person sustained? Am I making it worse? What I'm doing to help, is it actually helping? So yes, they want to help, but maybe we all
sometimes the help ends up not being
quite what was needed.
Okay.
So in terms, has there been an improvement? Well, the general attitude is, I would like to help if I could, but with more training, with more exposure, with more education, people can actually respond better.
Okay. Who are the the agencies in this instance who actually have the responsibility to respond to such, you know, incidents like road accidents, for instance, or building collapses?
For the road accidents, the Federal Road Safety Corps, Federal Road Safety Commission, has been very, very vital. We work in partnership with them, so I can say on a personal basis that I've seen them, I've seen their operations, I've spoken to some of them, and you understand that they are dedicated, they are committed to reducing the number of road traffic crashes, the number of road crashes that are experienced in Nigeria. Then for other emergencies, like large-scale emergencies, you have federal agencies like the Federal Emergency Management Agency, FEMA. You also have LASEMA. So states are also going on to establish emergency response, emergency management agencies. And someone mentioned to me that other government agencies, such as even the police, are setting up disaster management bodies because everybody is becoming proactive. Trauma has been recognized now as a disease state. It's not just something that just happens. Yes. So people are beginning to plan for how to respond.
Okay, and from your partnership with them and from your personal observation, would you say that the time, the response time, you know, has reduced as to when they get to the site of an accident?
You know, there are a lot of factors. There are a lot of factors because if you want to look at Lagos, for example, the road networks are such that even if they wanted to respond within the shortest possible time, do they have access to the accident sites? Then you look at the culture of people in this environment. When there's an accident or something, there's an emergency, you find people crowding that area. And it reduces access of the emergency response teams to that place. So I cannot categorically say that, okay, response time has shortened from 40 minutes to 20 minutes. I know more effort is being put in, more equipment is being acquired, more staff are being trained to improve their general the general output of these agencies. But like I always say, education is so important. When you educate people about how to respond generally to emergencies, they help these EMS people get there and act better.
Okay. I was actually reading up on something about trauma, and I came across something that is being called the golden hour. You know, like being the first 60 minutes between, like after an accident has occurred. Tell us, you know, what really has to happen within that period from when an accident happens to be able to really save that person's life, because it's something that is like a vital 1 hour, vital period that, and the life of the victim depends on what happens within that period.
Okay, what I understand by the golden hour is when somebody undergoes some form of trauma, within 1 hour, the earliest time following which they can get good medical attention reduces their chances of either disability and death. Okay. And there's some things that you should take into consideration. If somebody suddenly collapses or suddenly has a cardiac arrest or suddenly suffers some form of injury and the person is bleeding, the first responders at the site are the best people in a position to provide pre-hospital care. So if you are a trained first aider, that means the person's chances of survival are going up, because automatically you know how to apply a bandage, you know how to apply pressure to the wound, you know how to call for help. Because a lot of times the interval between when people send for help and when help actually arrives affects the outcome of the victim. So if you're there, you know enough to call for help, call the emergency number, and that brings me to the point where cities, states should have emergency numbers. Actually, we should have direct channels of access to emergency medical services. So when you call for help and then you begin to provide first aid, if you're the one that is there, you're automatically increasing the chances of the person surviving. Then the time during which the ambulance can now arrive and then the paramedics can take over care until the person gets to the hospital. All these things play a role in ensuring that within that shortest possible time, that person is getting definitive care.
Absolutely. Okay, we are looking at treating accident victims and trauma care. If you're just joining us, that's our topic of discussion today. And I am still with Dr. Amaka Adekoya, who is the Programs Manager for Trauma Care International Foundation. Okay, so